The topic of tonight is pandemic preparation. What did we learn from this pandemic that will better prepare us for the next one? And what lessons should we have learned? What lessons didn't we learn well enough? And what policies specifically should be implemented both at the individual, the practice, the system, the policy levels? You take your pick where you want to start.
I think it got way too political. And that was all, most of the problems, in my opinion, could be traced back to politics. And I don't know how you separate it, but it doesn't make any difference which side you're on. It was, in my opinion, out of control.
Yeah, I think a lesson that we supposedly learned, but we really haven't learned, right, is supply chain dynamics within medicine. We realized that we were having pretty much everything manufactured outside of our own nation. Okay. And when you have lockdowns and when you have people that can't be mobile, they can't get on planes, you can't transport goods properly, you have these huge shortages, right? Like masks and things like that. And so unfortunately, I don't see that we brought a few of those companies back or created new companies here. You don't have to bring them back. You can create your own new companies here for a lot of the supply chains that you would need during a pandemic. And then the other thing is I don't really understand why we don't like oil. We stockpile oil, right? For epidemics, we stock for all sorts of reasons, but we stockpile it. And some of those are financial and economic, but we don't stockpile these types of items that you would need in case you face a pandemic. Now they'd have to be replenished. It's not like oil. I don't think it could sit there for 10 years, but shouldn't we have like a national stockpile of some of this stuff? Interesting to me that we didn't come out of this doing that when we had massive shortages. I mean, doctors, nurses, everybody's working without masks. I mean, you didn't have equipment at some places, you were sharing ventilators. I heard about that. Or, you were handbagging here and handbagging. I mean, it was just bad. And when you hear that and you see that we didn't even learn from that, really, we didn't learn. Our memory is so short because that time is gone and now we've got everything. So, we don't have to worry. Yeah, it's almost like needing strategic reserves, right? So we required that from the banking system after the financial collapse. 2008, right? To some extent, now they were required to keep, or were actually required to increase their reserves. I don't know. I think you're right. I think a lot of this started probably when we tried to apply business thinking to medicine and medical management, right? Just in time works for Walmart really well. I'm not sure that it does work to some extent in the medical area, but you are dealing with life and death. And you have anything that'll disrupt that supply chain. I mean, people could lose their lives. So I really think the supply chain is the big thing that we yelled and screamed about for the first 6 to 9 months of COVID. And now it's like, whatever.
The fact that treating of patients was being crowdsourced by physicians on Facebook to me was absolutely insane. Like I sat there, I had transitioned out of a face-to-face clinical role. So I was only doing telehealth at that point. And it really was, I think I was distraught at the inability to get, again, the best information about here are the treatments that are working, here are the treatments that are not working. How do we get, again, the best information about the patients that are doing the best to those frontline providers across the entire US would be, something that I think we failed miserably at.
Do you feel like we learned our lesson on that? Or is that something that we're still grossly under appreciating?
I haven't seen anything that would say if it happened again today, would it look any different? No, I don't think it would.
We've learned it and we know it, but we don't have the motivation to put it in practice. I mean, when this all first started, everyone was real motivated and hyped up. Now things sort of settled down.
What's interesting, Dr. J, you commented on like talking to people and, seeing what the patients were actually responding to and what they weren't. And this is where I think we have become overly dependent on protocols. Because if you can't create an evidence-based, like what evidence are you going to have with the new pandemic is beyond me. But if you can't create an evidence-based,
come through Facebook posts, that's where the evidence could have come from.
right?
AI,
Well, yeah, I mean, data-driven, right? Data-driven
Yes.
medicine is very different. I agree. I think evidence-based medicine has had its time and it's over. I think it should be data-driven. It should be personalized. That's something we should have learned, because some patients responded to, like, the vitamin D issue took forever. You come to the integrative medicine community, we've known for years in the literature about vitamin D and viruses and what happens, and the fact that your levels go down and it can be protected, all that stuff, right? There's been evidence for that, to be honest with you. But, I remember initially having these conversations like, we should just do it. It ain't going to hurt nobody. I'm not going to make them hypercalcemic with a few doses. But yet you got this pushback, like, well, where's your evidence? There's no protocols. I mean, that is what happened.
Part of it not only is protocols, but I think part of it is our reliance on even the EHR, the digital solutions that we have at this point. It's almost the dumbing down of medicine.
It is.
That, like, this idea that we don't really have to think anymore. And you are not this idea that, well, again, like we had no roadmap. So when you have no roadmap, you kind of go back to the things that you think you know. But in this case, to your point, like, those things were not working. So then we needed to take a step back and say, all right, we clearly need to approach this differently. How do I get the information on what's working in other places? Because unfortunately, there was no one out there saying, not only we have PPE for you, don't worry, but we also have, again, data-driven evidence on what's working and what's not working. Like that, to me, I'm like, okay.
I mean, I think a lot of people knew steroids worked early on. The problem was if you can't get a big randomized double-blinded placebo-controlled trial, we were hard pressed to get any kind of big groups to actually back that early on. Eventually, people created things that worked, and we did get the word out on how to best treat, like, COVID pneumonia, MISA, MISC, which we're seeing now. But I think we did a much better job, by the way, with MISC. I think that came out early. I think that we somewhat understood it because it was an inflammatory condition similar to some of the other things we've seen in pediatric hospital medicine. And I think we did a much better job because we had a protocol, like you're talking about protocols, but we had like a tiered system, like, think of this, is this in the history? Ask yourself this, get these labs, and then call the hospice, call the rheumatologist, and the ID specialist, hospitalize the kid. We did that very early on, but we did it because I think the UK came out and they reported all the cases that they had. So in our country, because there was a lag a little bit, we were realizing, oh yeah, this is going on. Somebody better figure this out real quick.
Part of it too, I think, it goes into Katie's point, is somehow we've lost the art of medicine and the science of medicine. When I practice anesthesia, it's much different than when I practice pain medicine. When I practice pain medicine, I really don't care too much what's written on the chart, because there's all these secondary gain issues, the drama, the depression, all the personality issues. I want to talk to that person, look them in the eye, see how they walk, they talk, how they hold themselves, their speech inflection. Do they look me in the eye? They look off to the side. Does it all make sense? Does their gait actually match with their purported underlying disease processes? And, all that gets mixed in together. Now, with COVID, it's a little different, but still, I think we've missed a little bit of the art of that. And the art only comes with years of experience and, making mistakes. Looking and talking to the patient and the family is much different than what's on the chart. And unfortunately, when you go in to see your doctor now, in the nurses too, they're clicking on the computer instead of looking at you and getting the gestalt of things. Maybe I'm old-fashioned, I am old-fashioned, but that's what I find works for me.
Yeah, I totally agree with you. I mean, this goes to the whole, I recently had a discussion with a colleague about the ACGME hours restriction and training and what it's done overall. And, they're good about reading the articles about, learning about diseases in that sense. But if you don't see the volume, if you don't get that experiential background, you have the knowledge, but you don't have the experience and you can't have wisdom as a physician.
I'm curious to know, how do we, in an information-rich world, the amount of misinformation, I think, in the public was fascinating, and the lack of agreement on how to even approach this. Let's just take the medical care out of it, but how to approach this pandemic from a public health perspective. If we think about how, I'll take H1N1 because that is at least been one that I have been around for, how that was managed compared to how COVID was managed from a public health perspective. I think, and maybe it was the political pressure and or motivation behind it. How do we prevent in the future the misinformation, as well as some sort of coordinated voice, from what I would say is the medical community, because I think most of us are rowing in the same direction on, what should be happening from a public health perspective, which I don't think we saw at all.
What's interesting is there's misinformation in the public. And then there's also the medical community, right? So the one thing that I found concerning was that, you had a lot of stuff going to publication, right? Sometimes it wasn't peer reviewed, just to get the information, the data out there for people to look at and discern, right? And a lot of those were it was like agenda-driven medicine. And it worried me because what happens there is I want to see when stuff doesn't work, or when people are harmed by something, or when it works, but it's limited value. I just want to see it all, because then I can assimilate what's right for the patient that's standing in front of me. Right. And I think a lot of things got retracted. And then all of a sudden, it's all agenda everywhere all the time. And even as a health professional, it became difficult to discern, like, was this a good negative study? Was this a good positive study? Who published it? Why did they now you got to get into people's motivation. It was insane. And I think it's not been fixed once. We're still having a debate about, the one vax versus two vax for young teenage boys, and that's out there. But, or two doses. We as a medical community have people with agendas any which way you want to push them. Okay. And I'm not talking about one way or the other. And that's what's driving what gets published or what doesn't get published. Then there's mistrust in our own community as healthcare providers. And then of course, there's going to be all sorts of total lack of trust by the public. And I think we have lost the trust of the public. I see it every day.
I don't disagree with you. And so then I look at, okay, how do we turn that part around? Because I would say a ton of healthcare providers have already felt like the respect that our parents and our parents had if they were in medicine, that doctors used to have in medicine, is completely gone. And that had already been eroded, I think, for a lot of providers, or felt like this perceived erosion, again, based on the fact that Dr. Google has more information than maybe your doctor has, or at least there's an alternative out there. But you take to this level what happened, I think, and
yeah, I'll give you an example. I had a conversation with somebody who used to be in pharma, pretty educated woman, senior vice president of a big company, retired. And we were having a conversation about, the vaccine, COVID vaccine, and for kids and stuff. And she said, yeah, and there's all these kids, young boys dying from heart disease. And I'm like, oh, sorry about that. I'm like, they're not dying. Where are you getting? Some are getting myocarditis. Yes, it's not nice. It's not fun. They're recovering. We don't know what the long term is. But when you start saying stuff like that, nobody trusts you because they can figure out that it's not true. The mortality rates due to myocarditis have not like spiked to all-time highs. So it's stuff like that is just like, yeah, you have a point. There are heart complications for young boys with the second dose of the vaccine. That is a real discussion we should be having as a country, right? Because a lot of other countries have decided on the 1-dose schedule for young boys, right? UK and other places. And some have just decided they're not going to give like Moderna because the risks are too high for them for that. But you know, we have like counties that just mandate you got to get the 2 vax or you don't go to school. Okay, well, why can't we have a conversation about it? It's because there are people out there saying, well, you're going to die if your son is going to get the second dose. He's going to get some heart problem. He's going to die, which isn't true. And then on the other end, we're saying, well, it's not really that big of a problem, this myocarditis thing. Yeah, that's not so much true either.
That's hard for a parent to really perceive, to
Exactly.
be.
Is it America that's divided? Is it social media that's enhancing that division? Is Facebook evil, or is it just a reflection of what's already going on? Like, and honestly, we could probably spend hours on this topic, but it's not going to solve any problems about pandemic crap.
No, but I would say this idea that how do we prevent as much misinformation and actually allow for good information to get out there to the public is going to be a real issue forever, probably.
Okay, then how do we, there's a good question. How do we confront the core divisiveness that you know is going to happen again and again and again? Social media is not going away. So
No.
How are you going to confront that? How, like the CDC was freaking awful as the arbiter of the truth, right? So what does that arbiter look like? What does that central authority look like in the next pandemic? Who are you going to rely on? Who are you going to for the truth?
Well, you're not wrong about that. And Dimple, you mentioned this, like as a provider, you were looking for your source of truth. And I just kept saying, because this was, again, I was not on the front lines. I was sitting on my couch feeling utterly depressed of how horrible this entire thing was and how miserably our US healthcare system was, I feel like performing under this stress really was my guilt, my shame, there was a lot going on. Anyhow, a lot of emotions going on. No, but my question, I kept saying to myself, okay, I'd look at where's the ground truth for even number of cases, right? And I'd be like, all right, Hopkins is putting out really good information. I'm like, there are infectious disease. So if it's not the CDC, which no one trusted, like Hopkins, come on, Johns Hopkins has infectious disease specialists that should be the people that, at least for me, when I'm like, so they put out data, right? But did I ever see one of their infectious disease specialists? I mean, I'm like, who are the people that are the experts on SARS-CoV-2 in the United States? And why are they not out there talking about it? I heard more from politicians than I did what I would say educated healthcare professionals on what was going on. And that to me was, it was sad and hard to watch for my profession.
Yeah, and I think there was a lot of division within the medical community, in terms of treatment, diagnosis, all of that. And that just leads to more mistrust, right? I mean, it's very difficult to get back once you've lost it. And I mean, you really struggle with it. You struggle with it now with other decisions that are totally unrelated to COVID and trying to have shared medical decision making with families and parents and say, look, I really think your kid should get the flu shot. Flu shots are important. And they're like, oh no, because you guys, said this was important. And now everybody's getting a booster or it doesn't work. And I heard this on CNN and, your job becomes almost impossible because as one physician, you are fighting everybody, whether or not you agree with them or not, you're fighting them all because it's so much information.
the fatigue of just that, right?
Yeah.
You're trying to do your job. You're trying to do your best. I mean, if we look at least talking to my pediatrician colleagues in the outpatient world, right? They are like, oh my God, if I have to have one more conversation about this, like they are at their wits' end and they're trying just to take care of patients. But again, the ability, I think, has not been there to have, not that we need a single voice, because there needs to be room for dissent. But I also think there needs to be at least the ability to hear from the experts and the people that have the data and the information to get out there. I mean, it is, I don't know, it was crazy to me. It's still crazy to me, but hard to imagine. But you're right, Mike, it's not going away.
Yeah, I mean, honestly, I think this is a fantastic topic for longer term conversation. Like even in the summit, I think that this will probably be one of the topics, because we're going to say, you know, what is the biggest lesson that we learned from the pandemic that we have not been able to solve? And that's that the centralization and proper management of data. Like you look at even now, to all of your points, you're a year and a half in, you still don't track the difference between unvaccinated versus vaccinated breakthrough measurements. You still don't test whether, you don't actually measure those people that are testing positive but are asymptomatic as a ratio of the overall medical care. You still don't track all of the differentials between vaccinated versus unvaccinated, hospitalization, non-hospitalization. We have all of this data with the sheer number of tests out there. Yeah, we're gonna stop now because there are hours and hours of content that we can do on this. And frankly, I would love to do another roundtable later where we focus only on this, but I'd like to push more towards what is the solution as opposed to what is the problem. It's like basically, where have we learned our lessons? Meaning something we didn't know going in, but we do know now, and we feel like society has learned from it. Or vice versa, what positively surprised you about the reaction to the pandemic? Like what good things either happened that you thought, wow, we actually were more prepared in that space than I thought we were, or good in the sense that, wow, that was really a great lesson. We're going to be so much better off next time. And I know it might be a shorter conversation.
Yeah, I mean, I think, you know, one thing we did learn is that you could do team-based care. And what I mean by that is that there are not a million intensivists in this country, right? And you can't have them working 24/7. And I know within our system, what we ended up doing is you'd have one intensivist and like 6 medicine doctors, and then some family medicine doctors come in. And so it would be team-based. They would be like almost residents to the one intensivist. So you're not burning out the one person that has like the most expertise in the care of that, in that patient population. And all these other people can lean in. They're physicians. Maybe they don't do a lot of ICU medicine, but there's an intensivist there. And we have that goes back to having some protocols and caring for patients. But I think we did the MIS-C pretty well, I have to say. A lot of diseases have come and gone, and I think we did a good job of identifying it, of treating it. Yes, we've had some deaths with MIS-C, but by and large, I think that was the one thing that we figured it out early too.
Do you not think though? I mean, well, I guess in my mind, the similarities to diseases that we had seen many times before were probably, and to your point, there was an early release of the UK saying, this is what we're seeing. This seems interesting. This seems a lot like Kawasaki's disease, blah, blah, blah. Like, all of those things where there was pattern recognition, I think, much earlier on, and there was release of information sooner, I think, and potentially it was, I don't actually think it was, I think it was later as things developed over time, right? That we started seeing that. It was not right at the beginning. And so I think that's the other piece of it too. I don't know. That's my thought.
That's not a bad thing though, Katie.
No.
The fact is that
The learning curve.
that then is a lesson that should be applied to some of the failure points, right? If you say this is a place where it worked, then why did it work? Why was it more effective? Can we apply that to these other places where we didn't learn?
Yes. I don't disagree with you. You're exactly right.
Mike, I have 3 points, two that are on topic here and one that I failed to mention previously.
So,
What good came of this? Telemedicine. Before the pandemic, you had to fight tooth and nail for telemed. Now, within my RHC, we could do it. But outside of that, CMS and Blue Cross essentially warned me that they considered that fraud and to cut it out. And two, you couldn't get paid with the privates. They saw it as circumventing, all this nonsense you typically have to do. So I think telemedicine here was a big help. And along with that is virtual communication and working from home, which is a little bit outside of medicine, which was a godsend for a lot of us in a lot of different ways. It was always there, just now we got to do it. Another issue is the free vaccines. I always had an issue with having to pay with vaccines. It's a public health thing. So why should individuals have to pay for vaccines? I mean, it's kind of silly. You want everyone vaccinated, make it free, make it easy, make it convenient. That's I think we should just take it outside of COVID and do all of them for free, in my opinion. And now back to the other question of what did we learn and really not learn, is preventative care, healthy living. I brought this up every night of the week, is you look at folks that are in better health, they did much better. And we're our own worst enemies: diet, exercise, lifestyle, allowing stress. I mean, we talk about stress as something externally applied. No, stress is internal. We're the ones that determine whether no one makes us happy or makes us sad. We make ourselves happy or sad based upon circumstances. Someone can be irritating, but that person didn't make me angry. I made myself angry.
You always have a choice, right?
This goes back to something Katie said, and I'm so glad you said that, Dr. J, is that, with the trust issue with the medical community and the varying opinions and all that, never once did I see any 3-letter agency or university come out and make a broad statement about let's reduce everybody's risk factors.
Never.
Let's do like full court press, all hands on deck.
The data was so clear.
Because if we had done that on the first surgery thing and we had all done full court press on that, I don't think the second surgery, because it was, again, the same types of people, right? Obese. Well, you can't fix elderly because you're older, but obese, diabetes, with underlying heart condition, other chronic diseases. And if we could have addressed that, I just, but I don't remember. I don't know. Maybe you guys remember somebody coming out and with some authority.
I will say that in the New York, New Jersey area, that was a topic, because that was where it hit first and hardest because of New York, New Jersey density of population. And so there was a lot of commentary going around talking about if we were all living healthier, it wouldn't be as much of an issue.
Right, but I mean, the government
there wasn't an agency that said you need to lose weight, but at the same time, I'm not surprised there wasn't, because at that point it would have been like tisk tisk tisk, he deserved to die. No political or public agent or public person was going to come out and say it's because you had lived an unhealthy lifestyle that you're dying. They would have been crucified immediately.
You know what though? So I think it was.
I'm saying you're wrong. I'm just saying that they would have been crucified.
Right. I'm pretty sure, and I wish I bet I can go back and find it, because I'm 90% sure it was Kaiser Family Foundation, because I love the stuff that they put out. But they buried the lead in a major way. And it was clear by the data that they were showing in this, that is absolutely what the issues were. But did they actually call it out in this, compilation of data that they had? They didn't. And I'm like, Dimple, you said it and Johnny on the spot, you did too. Where is the medical community saying, again, with a resounding voice, right? We need to take this on in the US. We really need to take this on. I mean, people need to be more responsible for
I mean,
helping.
I would make the argument that more people are going to die this year from diabetes, heart disease, and other complications of unhealthy lifestyle than are going to be dying of COVID. And yet that hasn't stopped anybody from.
But there's no money in it, right? There's no reimbursement. The reimbursement for diabetes programs, I mean, right? There's some diabetes prevention programs you can get reimbursed for. But let's be frank, when this came out, it was all the money went to certain things. I don't know of any increased reimbursement or the government sponsoring, like if you can put together virtual programs for your diabetic patients, for your obese patients, we will increase, Medicare reimbursement, Medicaid. We put a lot of money into figuring out the pill or the vax or whatever to get this disease out of there. And I was just thinking at the time, like, why can't we allocate funds to help? Because it's not enough. I agree with you, Dr. J. It's not enough. Physicians that do this full time, like integrated medicine physicians, they're fee for service. There is not enough reimbursement to keep your practice if you're just trying to get paid by Medicare and, some of the health insurers. It's not there.
And, Mike, one other thing I think is good is before the pandemic, all you could hear from insurers, health systems, and politicians was the evil medical empire and how much money they waste, and we have to cut. We're going after pharma, we're going after this. When COVID hit, you haven't heard anything about the cost of medicine at all. And, I'm not saying it should never be questioned, but before we were just cutting off our nose to spite our face to save a few nickels and dimes here and there. And it was a political thing. You don't hear politicians saying a word about that. Granted, there needs to be questions and scrutiny, but I think that's a good thing that we quit focusing on nickel and diming medicine and opened up some innovation across the board outside of infectious disease.
Sorry, to second what you said around telehealth, there have been actually changes, and you might have mentioned this, but changes in reimbursement and policy, I think, that have much more supported virtual care that are going to stick around. So far, they have not rescinded those, which again, very good thing, because again, you're going to get reimbursed for some of those things, not necessarily helping people get healthy, which is unfortunate, but some of the other things, there are new policies in place that allow for that, which makes total sense. And clearly people have realized, A, not only can the healthcare system do it, but B, it's the right thing to do. And C, oh my gosh, it costs less. Imagine that. So all good things.
It's here to stay. I don't think we're seeing a backtrack on that. It'd be political suicide. It's all politics. I mean, these decisions are made in Washington, D.C. and state capitals by non-healthcare providers. These are made by politicians and businessmen and the insurers. So you have to look at their motivations to keep their job. And it would be not a good idea for them to challenge this. And I think once it stays around for a few years, it'll be institutionalized. Thanks so much, everyone. I enjoyed this. This is as much entertainment as it is knowledge. So I'd rather do this than watch TV. I enjoy this much.
For you, you're going to be a much happier person because of that.
I'm with you. This is what I would have done if I were sitting at a bar, is have conversations like this anyway. This is my best form of entertainment. You have a great night.